that Ms. Bonamici asked. And I'm a physician by training, come out of academics, and have done clinical trials. And I'm extremely worried about how we're talking about the efficacy of the vaccines. And I even hear it in the discussion here today, because in truth, you have to design the clinical trial for a common event, which is catching the disease. But there are other outcomes that we're certainly trying to prevent with this vaccine: serious illness, hospitalization, and death. And when we talk about the Moderna and Pfizer as being more efficacious than Johnson & Johnson, that may be accurate in prevention of disease, catching COVID, but each of these vaccines are super effective in preventing serious illness, super effective in preventing hospitalization, and super effective at preventing death. And that, is the truth for AstraZeneca as well. That's the truth for Novavax on the data that we can see. And I'm extremely concerned that if we don't start with the positive message of, it's remarkable that we have potentially 5 super effective vaccines that are going to prevent you from getting seriously ill, that absolutely are keeping people out of the hospital, and as far as I can tell, nobody's died who's received any of these vaccines. And I see our best spokespeople from the administration on television, on cable news all the time, and we fall into this message. And the risk that we're going to run is someone's going to say, well, I heard someone say Johnson & Johnson's not as effective, so I'm going to wait a while until I can get the Pfizer vaccine or the Moderna vaccine. And maybe, Dr. Butenheim, this is kind of your area of expertise. I've seen you quoted in some articles, and I am extremely worried that we're setting ourselves up in a way that is going to slow down vaccinations. And again, those 3 other variables, serious illness, hospitalization, and death, all of these vaccines are incredibly effective. Would you give us, as members of Congress and others, again, because we fall into this trap. So what's the best way to message these vaccines?
I think there are a couple strategies we can draw on. One is analogy, right? So no one asks what kind of vaccine they get when they go for their flu shot, right? It's not even an issue. You may not even know who makes your flu vaccine. And so we need to transition our vaccine promotion programs to be more like that. You're getting a COVID vaccine. I think we also need to, and this is unsettled science, but we need to think about how to, as you said, really hone in on the adverse events, the severe events that are not happening because of these vaccines. And this is always a challenge for health promotion, right? We're trying to get people to do stuff so that something else doesn't happen. That's really hard. And if the thing that's not happening is even more rare and probabilistic, that's additionally challenging. So I think we need to pull in our best, social marketing, advertising people to help with these frames and these messages that make most salient for people as they're making a decision, like any vaccine is a good vaccine decision here.
Right. And so starting with the positive, right? It's starting with that all of these vaccines are super effective at, preventing serious illness, keeping us out of the hospital, and certainly, preventing death. And if you can get a vaccine, get that vaccine, whichever one of those vaccines that are available.
The best vaccine is the one you can get tomorrow.
Exactly. And we probably have to start with that message.
Yeah.
Right? So, because, what I'm very worried about is in many rural communities and harder to reach communities, just logistically, the Johnson & Johnson vaccine may be the easiest vaccine to get out there. If you're vaccinating homeless folks, at a riverbank, a single dose vaccine is going to be a lot better. If you're vaccinating college students that may not come back for that second vaccine, a single dose vaccine is going to be better. I do worry, though, that there's that potential where folks might say, well, why are you using a less effective vaccine in some of these disadvantaged communities, and you're using and again, I don't think those aren't equivalent.
Right. And you're right to worry about that, because that is going to happen. So I think with J&J, we can promote, it's like the convenient vaccine, like one and done on this one. Isn't that great? But yeah, the more we can take that choice away from people and not fall into the like, oh, I'm going to wait for Pfizer, the better off we'll be.
Right. So again, just to my colleagues, if we can start with the positive, that we are so lucky that, we have potentially 5 great vaccines that are going to do a remarkable job. Get that shot in your arm. So I think my time's up, and I will yield back.